So Clayton's story, a bit of a misnomer there. We are going to talk about Clayton's story, but like all of us, his story is so much more complex and deserving of a deeper, richer conversation than this 15 or 20 or 30 minutes will allow. Clayton wanted, we talked about how we were going to present his story, and when we decided that maybe we wouldn't have a lot of time to really delve into that, Clayton thought it was really important to talk about all of the various things, people, factors that when life was really off the rails for him, that allowed him to come back to family and friends and work, employment. So we were asked, Home Society in Abbotsford, we serve adults with intellectual disabilities. And over the last 10 years or so, more and more of the young men and women that come to us are somehow struggling with substance abuse, misuse, addiction, and their life is very challenging. And as caregivers and as an agency tasked with providing service to these folks, it really stretched us, and it really created a place for us to take a step back and ask, like, what are we doing here, and how are we going to maintain a culture of gentleness while still serving people who are clearly making decisions that are not in their best interest and are causing them harm. So we did some digging around, like what tools are out there, what can we find? And we looked at folks that worked in addictions, and the conversation around harm reduction came along. And as we moved more into that, the similarities that exist, even in language, between harm reduction and a culture of gentleness are really quite striking. And in BC, and I'm sure it's hit here as well, but we had over 900 overdose deaths last year in British Columbia. The opioid crisis, fentanyl, carfentanil, are killing people three a day in British Columbia. And that includes folks that we serve. So one of those realities today is naloxone kits that we need to provide to our caregivers, to our home share providers that are working with people with addictions, because somebody they love, somebody they serve, they might be overdosing. So we needed to provide training to our caregivers on naloxone. Some of the language that we talk about, I'll read a little bit, but it's just the stuff in the red that I'll look at. Critics of harm reduction typically believe that tolerating risky or illegal behavior sends a message to the community that such behaviors are acceptable, and that some of the actions proposed by proponents of harm reduction do not reduce harm over the long term. And in a gentle teaching world, we often hear, well, you know, if you don't teach people that it's not okay to strike out, if you don't teach people, if they don't learn to know better, nothing will ever change. And we know that that's not true, that when we focus on making people feel safe with us, engaged and loved by and with us, that in the long term is what makes a difference. Harm reduction approaches are practical, feasible, effective, and safe. Most harm reduction approaches are inexpensive, easy to implement, and have a high impact on individual and community health. A culture of gentleness does not require university degrees. It does not require bringing in professionals to diagnose someone's behavior and track data and create intervention plans. It starts with us as caregivers. It starts with us looking at ourselves and what we can do differently when we're supporting someone who is seen as challenging, who struggles with addictions, who struggles with any of the challenges that life throws at us. We found that when we focus on inexpensive, but the tools that we have right with us every day, those are what makes a difference to folks. Harm reduction interventions are facilitative rather than coercive and are grounded in the needs of the individuals. As such, harm reduction services are designed to meet people's needs where they currently are in their lives. A gentle teaching philosophy says, we don't expect change of the other. We look inward, we change ourselves to meet the needs of those individuals. Those individuals may never change. I mean, we know that they do, but that's not our expectation. We don't go into it forcing people to follow a prescribed set of living rules or health rules. We know that people are more likely to take multiple tiny steps than one or two huge steps, that people just don't suddenly turn off the tap, and life has changed. They're slow, they're incremental. They happen better when they're with people, when they're with us. Harm reduction practitioners accept people as they are and avoid being judgmental. People who use drugs are always someone's son or daughter, sister or brother, or father or mother. In a culture of gentleness, we recognize that we're individuals. Everybody is deserving of love from us, deserve to love others, and they are someone's son, daughter, brother, sister, mother, father. Harm reduction practitioners oppose the deliberate stigmatization of people who use drugs, describing people using language such as drug abusers, a scourge, bingers, junkies, misusers, or social evil, perpetuates stereotypes, marginalizes, and creates barriers to helping people who use drugs. Terminology and language should always convey respect and tolerance. In our world, in our sector, we've often served people who have been labeled as biters, runners, diggers, headbangers, all of those very disrespectful, harmful labels that marginalize and push people even further away. In our culture of gentleness, we've changed all of that language so that we talk about individuals, we talk about people, we talk about love, we talk about being with people. We don't put names to them. I'm not sure how this shows up, but actually, can I grab a glass of water? I missed my mouth. That's hard to believe. Anyway, we will talk a little bit about Clayton and his story. Clayton, when you look at people who suffer with substance use, addiction issues, he hits pretty much every checkbox on that list. Grew up with an absentee father, alcoholic mother, series of boyfriends that came and went, violence, frequent moves, instability, housing, homelessness. Mom was in jail, out of jail. He and his brother in and out of foster care. So all of the check marks that go with what typically leads people down the road to addiction were all present for Clayton. And so this is about 2 years ago. Clayton was in the middle of probably a 3-week crack and crystal meth binge at the time. And his caregivers, he lives in a home share model, and his caregivers kept that connection even when he met a young woman who he fell in love with, and she introduced him to the wonderful joys of physical love, and he followed her anywhere. And that, in his case, meant to the streets, and it meant to hard drugs, and it meant to him being homeless, couch surfing. She prostituted herself in order to pay for their drugs. And his caregivers kept contact with him. They met him on the street. They brought him his meds. They brought him smokes. He came home and would shower and crash for 2 days and then get up and leave. They never wavered in their support to him. They went to crack houses. They supported, and they kept that relationship alive. So when Clayton was ready to reach out, when he was ready for change in his life, there was a relationship there that he could reach out. And when he called and said, "I'm done, come and get me," they were in their car, Brendan and Serena were in their car and gone, and picked him up from one of the dirtiest areas of Surrey, place in a suburb of Vancouver or British Columbia, and they brought him home. And they nurtured him, and they loved him, and they got him healthy. And he has slipped, and he's back out. In fact, he's struggling right now a little bit. But things are okay. He has a steady home, and he has a relationship. What mattered to Clayton was as an agency, and his home care providers not judging him, not setting these hard and fast, if you choose to use, you're gone, we can't support you. His addiction took him there, but that door remained open, and they worked really hard to keep that relationship alive so that he had a lifeline to reach out to when he was ready. When he reached his bottom, there was people that he could reach out to, and they were there for him. Clayton came back and part of a work crew. So we have a maintenance crew. He works around, we have about 30 different properties that we manage. He's a part of that. So he gets a steady paycheck. He works with people. He's a part of a community. Home share provider has a little daughter named Taylor. This is Clayton and Taylor. This was just taken a couple of months ago. Clayton's in a good place. And it's because of that culture of gentleness, that acceptance, that non-judgmental peace, that loving him when he couldn't love himself, when he wasn't able. He talks about that picture, the one I first started, where he's leaning in the car window, and they were begging him to come home. And he says now there was nothing he wanted more than to get in that car and go with them. But he just said, I couldn't. I was a worthless piece of drug-addicted shit. It was his language about where he was and why he couldn't get in that car and go home with them. And I've taken it down, but it was a pretty crucial time for him, and one that really, really stayed with him. Dr. Gabor Mate, I'm not sure if anybody has ever heard of Dr. Mate. He's out of Vancouver, out of the east side of Vancouver, but he's a world-renowned addictions specialist. And his work is very in meeting people where they are and about harm reduction. And he asks a brilliant question, not why the addiction, but rather why the pain. And this is a very short video that maybe we can run through. And
it was Dr. Feliti's California studies that showed that for each adverse childhood experience, such as sexual, physical, or emotional abuse, the death of a parent, the loss of a parent, the jailing of a parent, which we're doing massively in this country, as many people have pointed out. For each of those adverse childhood experiences, the risk of addiction in that child go up exponentially. So that by the time a male child has had 6 of these adverse childhood experiences, his risk of having become a substance-using, injection-dependent addict is 4,600% greater than that of a male child with no such experiences. Again, it's the context we have to understand and the history. So the first question in dealing with addiction is always not why the addiction, but why the pain. But why the pain? I don't have a single female patient in the downtown east side who was not sexually abused as a child. Not one, not even by accident. I've talked to hundreds. Many of the men were abused, many sexually, if not sexually, then physically in other ways, or emotionally abandoned and neglected and hurt. A policeman who rescued kids from internet pornography. And he's a very humane cop, and he really extends himself to protect these kids. And he says about these children that what's worst about it, he says, is that they're not screaming, just accepting. They have dead eyes. You can tell that their spirit is broken. That's their life. Now the irony, of course, is that going to all the studies, if that cop had transferred to the drug squad, who do you think he'd be chasing in the street? Those same kids that he didn't rescue. In other words, in this society, we punish people for having been abused in the first place and then turning to drugs. Not to mention, of course, that we live in a society that devalues human beings in favor of commodifying everything and everybody, in which people are made to feel insecure, in which people are made to feel that they're inadequate, and in which they're made to feel that they have to complete themselves from the outside. In other words, we live in a society that itself, in its very nature, highly addictive. The very idea of the pursuit of happiness, how can you pursue happiness as if it was something on the outside of you? That induces an emptiness, it induces a craving for something to be completing you from the outside. In this society, what do we expect? But that many people will turn to addictions to soothe their pain, to soothe their emptiness, to somehow fill the spiritual void in their lives. And this is not a culture that meets people's needs, supports their spirituality or their humanity. That's the context in which we have to understand drug use.
So when Dr. Mate asked that question, not why the addiction, but why the pain, it's a similar question to what we pose in our gentle teaching world, in our cultures of gentleness. We don't ask about we talk about people not feeling safe. They don't feel safe. We don't necessarily talk about why someone is maybe being aggressive or why someone lives with self-harm. We talk about what's going on inside. Why don't they feel safe yet with themselves, with the world around them? So we talk to people's hearts and not their heads. We talk to the heart and not the head. Why the pain? We all know things, you know, we all make choices in our daily lives that we know are not good for us. We smoke, we drink, we drive too fast, all stuff we know is not good for us, and yet we do it anyway. So talking to people when they're struggling about common sense things they should know, is not effective. Talking to their heart, asking why the hurt, asking what we can do to heal that hurt, how we can be a part of that healing for them. That's what makes the difference for people moving forward. That's what keeps them connected, and that's what keeps them safe with us, with themselves, and with the world around them. Just some resources here, gentleteaching.com, Home Society, Creative Options, and Dr. Bate and Say. I was very conscious of timelines. I know there's other presenters, but is there any questions or anything that folks would like to talk about? Excellent. I mean, that's okay.
I was just wondering, that first slide you had, the homoxiclone or whatever.
Naloxone?
Could you just
Go back to that?
explain what that is? Because
I'm sorry. Yes, thank you. It's an overdose prevention kit. It's an injectable, similar to an EpiPen type thing. So it reverses the effects of opioid effects on the brain. It actually neutralizes it. So when people OD and are literally dead or unconscious, naloxone, it's not like adrenaline like they used, but it blocks the receptors for opioid use. And so it brings people right back to consciousness. And strangely enough, often they're angry and they need to get high again now because they're straight and you screwed up their high. However, they're alive, so that's important. Yeah.
do you find it's a hard line between enabling and also instilling the values of gentle teaching with an addict?
Yeah, absolutely. It's very challenging. One of the challenges that we face is that we, folks like Clayton, it's certainly capable of, but harder for them to maintain employment in the community because of the instability, the unpredictability. And so with our work crews, we provide work to people, which also provides a paycheck, which is a means to get high, get drunk, do whatever. So we do walk that fine line. Addiction takes people places that's beyond our control. We cannot control what people do. So sometimes that addiction takes them out in the street, it takes them to jail, it takes them to hospitals. And all we can do at that point is maintain the relationship. And we do a lot of work supporting the home share providers. Most of our folks that struggle with addiction or drug use live in a home share model, not in group homes, or they live alone. So it's keeping that relationship alive. One of the biggest determinants they have found in helping people get off the streets or out of addiction is stable housing, right? So we work really hard to support Clayton's caregivers so that they're okay, because when they're feeling they've lost, they've failed, he hasn't been home in 3 days, he came home, he crashed, he ate, and he left. And they're like, are we just a revolving door? You know, what are we doing? And supporting them to know they've seen the result of keeping that relationship alive. I learned, we were in Ottawa at a gentle teaching Canada Symposium about 3 years ago, and I heard someone use the phrase during their presentation that they had failed successfully. And I was, what? Failed successfully? And then I think of Clayton's story and his addiction, which is beyond our control. We lost him to that addiction. You know, he left our services for a while. He was on the street. We failed. Except we kept that relationship alive with him so that when he was ready to reach out, we were there for him and we were there So we failed successfully in that model. And I think that's really important, that we work with our home share providers and our caregivers to understand that all we can do is be consistent in our approach to make sure that we have a culture that when people come home, they're not judged, they're loved, they're supported. You know, it's not, oh, I'm very happy you're back after your 3-day crack binge, but it's, honey, I love you. Are you okay? You look sick. Can we go to the doctor? Can I take you to the doctor? That type of conversation that talks to the heart, does set some idea of, we're really worried, we're afraid you're going to die. So those conversations do happen.
Hi. I'm new to this, never been to a corporate presentation ever, but as you're speaking to the heart, to love, my son was an addict for many years, has just celebrated 2 years of sobriety, and I didn't actually realize that the last few years prior to him getting well, I was practicing gentle teaching and I knew nothing about it. So as I'm listening to you say that your support workers found Clayton and gave him his smokes, his medication, mom brain's going enabler, 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 like Abby said. But my gentle teaching approach obviously was that my son's addictions were profound. But the gentle teaching that I'm speaking of was, no, you can't come home, but we love you. This is what we will give you. And we kept sending him to 3-month programs where they stripped him down to nothing and then threw him out onto the street. But the program that worked was the one that loved him unconditionally, never questioned his addictions once. They just concentrated on why he was so broken. And we sent him to BC. And it was the best thing we ever did. And now he works for that organization.
Thank you very much for sharing that.
You're
Thank
welcome.
you very much. Thank you. It is a fine line between that enabling, but I think one of the things that we haven't had much time to talk about in cultures of gentleness, and Tim mentioned this briefly, but it's the intentionality of what we do. You know, they weren't delivering them smokes and food just to give them smokes and food. It was a time that they could be together, that they could spend 15 minutes just saying, hey buddy, you okay? Here's some smokes. You know, do you want to go to the doctor? Hey, do you want to get something to eat? Oh no, I need $20. No, we can't give you $20, but we can spend time with you. We can get going. What? Your shoes are shot. Can I get you a pair of shoes? They would do those things, but they set limits. We're not giving you money, not a penny, not a penny. But they made sure that he was looked after.
For at least 3 years, I used to pick him up and sit in my car with McDonald's because I only got.
Yeah.
For at least in my car with a Big Mac and fries that he had phoned and ordered. But it was the only 10 minutes I got in a week, and then I'd hand him back to God and pray again, and we'd start again, and miracles happen. Yeah. They absolutely do.
And thank you again for sharing that, because keeping that door open, keeping that line of communication there, that at the end of the day, that's what helped Clayton, and I'm sure, as you're saying, was
exactly. And there may be other mothers, sisters, brothers, whoever that have this in their family, but for me personally, I had to love him to death, because if I didn't love him to death, he was going to die anyway. And now he speaks every single day to people, and he's giving back and teaching about. He's just so bloody lovely, guys. He's so lovely. And I knew he was. His addiction got a hold of him at 14. He's now 28. I mean, as a full-blown addict, he was 170 pounds. He was thin. He was rude. He was belligerent. He was awful. But I would tell him, no matter how bad you try and snap out the spirit within you, you can't, and you won't, and you're going to get better. And in the year that he was gone, He went from 6'3" to 6'4", which is kind of weird because he's 28. But I just think it's how he stands and presents himself. And he gained, I don't know, about 70 pounds. He's a buff, handsome, gorgeous human being, and I'm his mother.